name is Natalia Ronda. I am Dean of Allied Health and Life Sciences in the School of Health and Life Sciences. I took my opportunity at Conestoga in the School of Workforce Development, and I'm really happy to be continuing offering really exciting, relevant programming in the School of Health and Life Sciences. So it's my pleasure today to talk to you about health and social systems navigation. This is a new program to the Conestoga constellation of really wonderful and exciting programs. So I will be able to overview for you very briefly what the program is, what it does, what it will be able to offer you, and then what you can do after graduation. The social and health system in Canada is very robust, very well developed. We have a lot of services that are being offered to clients and patients all across the board. We have one of the most stellar health systems in the world. However, it does come with some complexity. So the Health and Social Systems Navigation Program really focuses on creating specialists that can help the community and the clients that are trying to access services to connect those services together into a package that will give them the best experience, the best outcome in terms of health and being able to be safe, secure, and happy in their lives. System navigators also very importantly advocate for clients and help them gain access to appropriate, relevant, and timely care. If you imagine somebody who has just undergone a really difficult healthcare treatment, such as cancer, and they will be considered in remission for all intents and purposes, their road to recovery is just beginning. There are so many other services that they need access to. Sometimes that includes other allied healthcare, such as physiotherapy, such as mental health services. Sometimes that cross-cuts other services, such as access to housing, access to employment, access to many other services that can help them get better, get on the way to full recovery. So this is what the System Navigator does, and that's why this is a really key position in healthcare and social services. So this program is an Ontario College graduate certificate that is 2 semesters long. We're welcoming applicants with backgrounds in healthcare, and I saw a few questions around will my background be appropriate for this program? If you are a graduate or a professional in any healthcare, particularly if it related to providing direct care or direct service to a client, you're absolutely in the right place. This is a program for you. We're also welcoming applicants from social services background. And I will overview in a moment with you what some of those opportunities in social services are. But to give you a few examples, early childhood education or educators, immigration settlement specialists is another really great example of that. So there's really a variety of services in both health and social system that come together to make this program what it is and to make this program really great. And as I mentioned, our systems are very robust, but because they have been built over a really long period of time, we have created systems that are quite complex and quite hard to navigate, even for people who are located within those systems. So the position of a systems navigator is actually quite new. If you're finding yourself a little bit confused as to what that job is, you're absolutely not alone. I would say in the last few years, there's been an increased recognition that the systems are great on their own, but now we need a specialist, a role that will connect those systems together. As I was mentioning, because of this complexity of systems, it's been particularly recognized that folks who are finding themselves in very vulnerable positions, somebody who is unwell, somebody who is sick, somebody who is seeking to get additional help and additional resources, they don't really have the capacity to navigate through all of this complexity. That's where a system navigator would come in. They would identify the need and they would find the right door to service, to access those amazing opportunities on behalf of their clients. They will help the client with multiple concerns to see what is the most pressing issue that they need to address, but also following through that journey of a client to make sure that all of the services are lined up to help that client. And also working with the client to make sure that access is equitable and they're getting the service that's appropriate for them. A few highlights of the program for you. This is a one-year program with 2 consecutive terms. As I mentioned, we are very welcoming of applicants with health or social sciences backgrounds into the program. This is a graduate certificate program, which comes with its own set of requirements. So you're welcome to review those requirements on the application page for this program. This program will offer an intake of new students every term, starting in fall of 2023. So if memory serves, the applications are still being accepted. I know that my colleagues at International Admissions will correct me if I'm wrong. But if you are not able to get access to this program in fall 2023, please don't lose hope. You have another opportunity to apply for the program every intake from now on. This is also a really great opportunity to look into a dual credential option. If you're interested in working in social services, you can look at the social services worker program, mental health and substance use, if that is the inclination that you have. And just to give you a sense of what you will be learning in this program. And we're working with really excellent expertise. We have subject matter experts from the local area and beyond who bring expertise in healthcare, mental health care, culturally responsive service. We're working with an Indigenous organization that will be bringing a culturally relevant Indigenous perspective to the table. So this is really an excellent collaborative opportunity for a number of experts from these industries to come together and build this program. So in semester 1, there's a big focus on communication skills, working with diverse clients, understanding the underpinnings of mental health and well-being, advocating for clients. And then in semester 2, we really delve into interprofessional collaboration, how to work with clients to make sure you understand their concerns, you can manage their case appropriately, the legal and ethical foundations of this practice, as well as system navigation practice, and of course the capstone, which will allow all of the students to create and manage a unique case in the domain of their choosing. And finally, the career opportunities. Please, I encourage you to go and type into Google search systems navigation or health navigation or service navigation and look at how many jobs, but also the variety of jobs that you can find at your fingertips that are being advertised right now. Again, I say this with all of the respect for this profession. It is very new, but it is very widely recognized now, and more organizations are starting to recognize the key importance of this position to their business. So in terms of the healthcare, you can definitely see many positions that are advertised for health service navigation or patient navigation. So this has to do with helping clients navigate within the healthcare system, but also navigate out of the healthcare system, if you will. So if we find an example of a senior citizen who has had a fall, they've suffered a fracture, they've recovered fully in primary care, they still need quite a long tail of services and supports to help them fully recover. And that's where a health service navigator would come in. There's also a number of jobs in the social sector, as I mentioned. So for example, housing navigators help clients with identified needs to find housing, to find affordable housing, to find housing in their immediate service areas. This also has some implications for employment navigators. And some of these opportunities definitely interact and cross-cut each other. So employment navigators, for example, would help clients who are underemployed to find appropriate employment, to find other services, to identify some of the barriers that they may be experiencing in finding appropriate employment. Sometimes that has to do with childcare, with transportation, with access to some of these services that I talked about earlier. There's also a big component and a growing component of service navigations for newcomers. And as you can imagine, that ties in aspects of immigration, aspects of social services, aspects of educational services, aspects of health services. And finally, of course, I did a flag earlier that education, and particularly early childhood education, is becoming, again, increasingly more complex and difficult to navigate. So there's a growing need for early childhood education navigators in the system as well.